Hello, I'm a clinician, so I'm actually a doctor, Dr. Forsyth, and I work at Roseberry Park Hospital as a consultant psychiatrist. But I'm here as a resident of Cotherston, one of the further reaches of the Dales, and Darlington A&E is my local A&E. My local A&E has been directly responsible for saving my life twice, one in a developing sepsis, another an acute asthma situation. It's been responsible for saving my mum's life about 3 or 4 times with malignant hypertension. It's been responsible for saving my daughter's leg, an emergency grade 4 tibial fracture, sorted out, organised, operated on within the same day. Brilliant, absolutely brilliant service. And as a medic myself, I can attest to having spent a long time at Darlington Memorial being treated, of the absolute excellence of the clinical care there, and I'm sure lots of people here are aware of that and agree, and I'm aware that the MPs have about 7,000 other people aside from me with stories such as that. But I think it's really important that those individual stories are heard in the context of wider strategic decisions. Critical in all of those events was the distance to the A&E. So those people who are living in the Dales and beyond are already an hour away. I'm amazed by the quotes of the distances and the time it takes, because in truth, we all know that even with blues and twos on, there are jams, there are roadworks, the ambulances don't get through. I've only once, and I travel back and forth to James Cook Hospital every day for work, and I can tell you that the only time I've managed it in 53 minutes was on Christmas Day with no traffic at all. And those of us that live in the Dales are crucially aware of those times and those distances. And those distances, if you are going to either North Tees or to James Cook, are massive. And they are a massive factor in terms of potential morbidity and mortality if you're faced with those in an emergency situation. It's obvious, and there's much sense, and all clinicians would agree that there are very good evidence-based reasons for having highly specialised, complex, niche services at centralised hospitals, such as James Cook with its complex cardiac care, major RTAs. Of course, that makes sense, and people would agree with those. However, I think we're all aware, and I won't quote the statistics, and there are others coming after me that will, but something above 90% of cases that come to A&E are not those cases. They are lower level trauma, complex issues, older people who have fallen down and are off their legs, have got renal difficulties, have got other issues going on. There are a number of urgent issues that don't fall into those niche specialised services that require a really good, excellent clinical service that is in with reasonable reach for those of us living in rural areas, including everybody in Darlington. And this is especially, I appreciate an argument for those living in North Yorkshire, of course. And the fact that the region must have an emergency system that's a reasonable distance away for those in the rural Dales, for me, is the key issue. Having all the services based at or near Middlesbrough area and James Cook Hospital makes absolutely no logical sense whatsoever. And the people of this region, Teesdale and beyond, are rightly passionate about Darlington A&E because we not only value and respect its excellence clinically and its excellent outcomes, but we desperately need its relative proximity of care. And that makes regional, geographical, local and clinical sense. However, an albeit expanded service at Darlington is of no use if the removal of North Tees emergency facility leaves the region's care unsafe. Because all the wonderful proposals, which we would all agree with, and as my colleague, not my colleague, but a clinical colleague has just spoken about in terms of Darlington, all those wonderful proposals to help move needs out of hospital, to improve and expand community services, reduce the level of demand on hospital services are fantastic, of course they are. But you need to make sure that those things have actually happened or are actually happening. And at the moment, we're talking about a prospect where not only have they not happened yet, but we also have a situation where, by definition, you are going to massively expand the input and the intake on one of those provisions, either Darlington or North Tees. So even if it is Darlington, marvellous, one could say, that doesn't necessarily solve the problem at all, because if Darlington is then faced with an overwhelming influx of people without the infrastructure, let alone the parking, to manage it, then it's a massive, massive problem for the region. So it isn't as simple as one against the other and playing one off against the other. And I think you risk having an unsafe heaving service at 2 hospitals rather than the current service at 3 hospitals. I suggest that the clinicians in the area are properly consulted and not in a tokenistic way. And that means not using a process that comes across as a bit of smoke and mirrors to present a choice, which essentially means you've already made the most dangerous decision, reducing 2 rather than 3. And then you say that decision's made and you provide a little choice after that. Well, is it North Tees or is it Darlington? And I suggest that you need to sufficiently provide data and evidence, which hasn't been done, to genuinely make a case that this proposal to reduce from 3 to 2 will, as has been discussed, actually give this region better, not the same even, but better clinical outcomes, because that case has not been made. Thank you very much.